Hello, I'm Dr. Oshodi at the Heart and Vascular Wellness Center. I'm a cardiac electrophysiologist and interventional cardiologist. Today I'm going to talk about the symptoms of heart disease. There are many symptoms for heart disease, and some of the most common symptoms are having chest pain or chest discomfort. Some people feel this as a pain, and some people feel this as some sort of pressure in the chest. And some people just feel it as tightness. In fact, it's not only in the chest. Some people could have these symptoms in the neck or the jaw. Sometimes it's the arm, the upper arm, or just the top of the back. Most of the time, these are unusual symptoms that people have not been having in their previous living situations, and it's just developed relatively recently. Sometimes these symptoms are caused by walking around or by doing exercise and different activities. The other symptoms that people tend to have could be related to shortness of breath. Sometimes people get short of breath. Sometimes they are unable to walk upstairs without stopping to take a break because they run out of oxygen or run out of air. The other symptom that people could have is fatigue, otherwise known as just tiredness. An unusual new sort of tiredness that has not been noted in the past could also be a sign of heart problems. Other symptoms include swelling of the legs, which is otherwise known as edema, fainting. Sometimes people have situations whereby they faint or they lose consciousness, palpitations, which are an unusual feeling of beating in the heart, such as sometimes people feel skipped heartbeats and some people feel racing heartbeats. Another question we get often is whether women have different symptoms from men when they have heart disease. And the fact is, most of the time women have the same symptoms, but they could have different symptoms which have to be interpreted very carefully. Women may have symptoms that just have to do with shortness of breath, and sometimes it's just tiredness. These are symptoms that men have as well, but men tend to have their picture dominated by chest pain. Women may also have chest pain or chest pressure, but they could have these additional symptoms which we have to be very careful about. When women have symptoms such as new tiredness, new shortness of breath, pain in the jaw or neck, or pain in the back areas, these could be symptoms of heart disease and have to be taken very seriously. If you think you may be having a heart attack, or if you have chest pain or chest discomfort, or even chest tightness that does not go away, we advise that you call 911 so that you can be taken to a hospital and be evaluated and treated. If you have intermittent symptoms that suggest you may have heart disease, such as the symptoms we have just described, please call our office to schedule an appointment so you can get a cardiac evaluation. Thank you for watching. If you have any other questions or comments, please leave them in the comment section below. Thank you once again.